Hi, welcome to the Fit and Healthy Today show. And today our topic matter is antibiotics. Friend or foe? I've seen this rash prescription or a rash amount of usage of antibiotics in my customers that have been coming into the store to grab their probiotics or acidophilus, none of which have been recommended by doctors except for one physician in the whole town. I'm seeing so much of a rash of this. In addition, the side effects that are going along with this, long-term wise, that maybe the physicians may not be seeing, that I thought this would be a good topic to address to make you or help you be more aware of what the ramifications, what the side effects are, the benefits and the problems with taking antibiotics. They were developed in the late 1930s, early 1940s, and obviously with tuberculosis and some of the E. coli bacteria that were around that were very simple back then compared to how they are now, they were found to be very, very effective against these what people deemed as heavy bacterial infections, oftentimes that would kill people. At that time, there wasn't a whole lot of naturopathic or alternative medicine being practiced at the same time. The antibiotics are capable of being very, very good, or they're capable of causing havoc with the body. And the reason being for this is, in the environment, there are species of bacteria, fungal, viruses, protozoas, all of them. They're in every nook and cranny, here, 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 here. They're around everywhere. And each of them have a function. They perform tear down of foods and nutrition, they eat, or they're scavengers, they each have a purpose. God didn't make these things for no reason at all. They all had a purpose. So, that keeping in mind, we would basically die if these bacteria died, including things like E. coli, Clostridium, all the bacteria that we see as being harmful to man when they get inside of our bodies. Well, believe it or not, they're already inside your body. The key is whether or not you can fight it off, and we're going to go into a little bit more about that as well. In your intestinal mucosa, and that's a little lining, feet and feet of lining that you have in your, what is also known as your intestines, small intestines, and then into your large intestines and colon. We have fluids and bacteria that line these, this intestinal mucosa lining. Per milliliter, and that's like about, fifth of the teaspoon, we have over at least 100 billion of these different type of bacteria in that milliliter of fluid in the intestinal mucosa lining. So when a doctor tells you to go grab a yogurt a day after an antibiotic, it would only take you about 10,000 years to make up the bacteria that 1 week's worth of antibiotic will destroy in that 7-day period of time. So we're going to get a little further into that. Bacteria inside of us, in our bowel, throughout our body, they communicate, and they're communicators in the body. They let you know when something's not quite right. And the intestines are, a lot of physicians are now, well, naturopathic doctors particularly, this is called a second brain. And we never thought too much about what went on here other than breaking down of food and all of that. Now we know that 80% of, if not more, of our immune system is here. Our serotonin production is here. Our ability to digest, break down nutrients. I mean, it goes on and on and on. And we have 400 to 500 different types of species of these bacteria within us that are very beneficial and necessary for life. Some lay on the top of the intestine, some on the bottom. They each like their particular, some lay on the colon. They each like their particular environment, and they grow and are very beneficial to us. They keep us healthy. What happens when we go into antibiotics is those antibiotics destroy these good bacteria. Not just billions, trillions upon trillions of these good bacteria. And long-term disease issues are most likely primarily related to the destruction of these bacteria caused by antibiotics, chemicals, and other things as well. But antibiotics are probably 90% of the reason why we end up with these problems with floor levels in the bowel. It's kind of funny. Most people, and I'll give you a perfect example. A friend of mine's husband went to help me go down and pick up my son's car, and we found out the next day, had pneumonia. In my car, hacking and coughing away. He's a smoker, and I just kind of thought, well, you know, he's smoking too much. And I'm kind of lung compromised, and so that being the case, if I would go by the standard germ theory, which Louis Pasteur went by, and he was the person that had recommended the pasteurization of all milk. He pretty much held that God had it wrong, and that basically whenever we get exposed to these bacterias or viruses or fungals, that they were going to infect us. Hey, and unless we're vaccinated or we try to kill them off or wash them off or all of this, that basically bottom line is we're going to get the germ or the disease. Obviously, I'm standing here in front of you today, 10 days later, I don't have pneumonia. I don't have a cold, I don't have a sinus infection, I have nothing. They found, very similarly, polio the same way. Most people were carrying polio viruses on them, around them, nasal-wise and everything, but 90% of the people never showed any symptoms or reacted. So, I tend to go by, and I think most natural doctors and some of the physicians nowadays are going by the second theory, which is not the germ theory. Pierre Bichamp, I probably said that wrong. You're not supposed to pronounce the P in French. These good bugs, these bacteria, the viral fungals and all of themselves, they're not the cause of the disease. What happens is when the body gets in the disease state caused by bad diet, chemicals, antibiotics, all the other drugs that throw on the tons of side effects and imbalances in the body becomes imbalanced. It can't identify friends from foes. You don't have adequate bacteria to prevent salmonella, all those wonderful things. E. coli bacteria form in the bladder because you've been on, for me, I was on a lot of antibiotics for bladder infections. No more, because I know what to do. But the point being is it gets you in a state where you're so imbalanced that you continue to be sick, and anything that comes near you, you'll get sick. So the key from bacteria, and I think this is where people really need to look at, is you've got to be in a healthy, balanced state. Otherwise, you're going to be a victim. There is no doubt about that. And as you watch our other shows, we address the diet, nutrition, and things. Pay attention to that. That's very, very important that you maintain that balanced, fit state so that you don't get the pneumonia when you're sitting next to the guy in the movie theater hacking away during the movie. Antibiotic toxicity. Now, you'll read the labels when you take your antibiotic, and it'll tell you all the side effects and the things that can happen to you, and you would be surprised how very common reactions are. In about 10% of the cases, somewhere in that, there is an allergic reaction to an antibiotic, and in a smaller fraction, you get anaphylactic shock. Now, anaphylactic shock is deadly, okay? And I'm that way with penicillin. I'll have an anaphylactic, start closing up, I get itchy, scratchy, I can't breathe, and if it went to too many extremes, if I had too many antibiotic exposures, I would die. So people have that to peanuts and things like that. So, because remember, penicillin and some of these others, depending on whether it's attacking positive gram or negative gram bacteria, they originally came from mold. And you're shooting yourself full of mold and taking things that are penicillin derived, and so that being the case, you can anaphylactically react and respond to them. Diarrhea and colitis, and this is probably the % problem that we're dealing with when we're talking about the prescription or prescribing of antibiotics. 12.5 to 22.2% in this London study found that people who take antibiotics on once or twice a year, not all the time, but you're taking, or people who take it for all. I have doctors who put patients on it and say you're on it for a lifetime, and I'm horrified because I know what they do, and they destroy everything that's here and leave the patients wide open. But when you have this high of percentage that you're going to develop and lose that much bacteria that your body's rejecting it, it's time to take a second look. They had a lot of issues out of Haiti when they were giving extremely strong antibiotics of people dying from anaphylactic and from this extreme amount of colitis, and basically they would have so much diarrhea they would dehydrate and die. So, you know, choose your friend or your foe. Ulcers in the esophagus and intestinal lining. So a lot of what we might be seeing with ulcers may be being caused by these antibiotics instead of excessive stomach acid secretion. Think about that for a moment. If you've taken an antibiotic, or you have an H. pylori bacteria and you take an antibiotic, causes ulcers, I'm trying to treat an ulcer, I wonder if this wouldn't be giving you a chronic issue. This has to be exposed and the risk factors have to be discussed. I'm not saying not to do antibiotics, but I'm telling you, you have the right to know all the risk factors involved in taking them. I'm not going to discuss today any of the natural alternatives, but they exist. Malabsorption of nutrients due to destruction of good bacteria in the bowel. That includes vitamin K, vitamin B5, the list goes on and on. You can't break down your food, you get sick. You get in a disease state, and eventually you die an early, very painful death full of autoimmune issues and everything else. And that's not how I want to go, okay? So, recognizing that side effect. Severe hearing loss, particularly in children. Chronic skin infections. Now, they estimated between 25 and 33.8% of the cases of severe hearing loss were due to antibiotic and antifungal drugs. Okay? So, for those kids out there who have chronic ear infections, we better, by God, make sure that that's a bacterial infection, because there were studies done, and I'll point this out further on, actually I'll point it out now, that basically said that antibiotics, when you know it's a viral infection, do nothing to prevent secondary infections in the survival rate and the illness of people. So I'm hearing all the time, oh, I'm giving this to prevent a secondary infection. The studies say they don't work. As a matter of fact, you make viruses and fungals and everything grow worse. So that's why a lot of times when you're being handed an antibiotic for an upper respiratory infection or a sinus viral infection, it doesn't work. 90% of the cases are viral or fungal based, not bacterial. And basically what the pediatrics associations say, we need to look into the infections further. We need to culture the throats. I mean, we need to do things to find out for sure whether or not these are bacterial infections before we start giving antibiotics that come with their side effects. The pediatric associations are the only, or the pediatric, particularly the medical journal that they have, it's called Pediatric, is probably one of the very few medical journals that's addressing this issue. Perfect example of this, my now 19-year-old son, when he was 2, he was given multiple antibiotic prescriptions. Hard to talk about this. When he was 2 years old for ear infections. He ended up with it turned intestines, and they had to cut him open. He was hospitalized for a week to tie down his intestines because the antibiotics had destroyed all of his good bacteria in his bowels by the time they were done with him. And that's what the pediatric surgeon told me. So, personal experience, I can speak this and I lived it. So, think about it. 10% of acute renal failures, kidney failures, are due to antibiotic, gram-negative antibiotics. 10%. Think about that. Kidney failure, dialysis, short life. Liver damage, including jaundice, hepatitis, and false hepatitis when you do testings. Acute pancreatitis, tetracycline in particular. And when you're talking about use of tetracycline under any circumstances with pregnant women, no way, no how, unless you end up with a certain type of dwarfism in limbs and that type of thing. You pregnant ladies out there, if you go on an antibiotic, you do it as last resort.